Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes with Valley Health. Non-invasive prenatal testing. It's something that can give you a lot of answers while you're pregnant. But what exactly does that entail, and is it for you? We're talking with Dr. Richard Booth about that today. Thanks so much for being here.
You're welcome, Melanie. Thanks for having me.
There have been so many changes with this, but let's explain to people what exactly is non-invasive prenatal testing. What does it encompass?
So, non-invasive is a simple blood draw on mom. They take the blood, they spin it down, they can actually separate baby's chromosomes from mom's chromosomes, and they can tell us the baby's chromosomal complement. You can rule out Down syndrome, trisomy 13, trisomy 18. You can rule out any sex chromosome abnormalities, Turner syndrome, Klinefelters. It's pretty much risk-free other than just a blood draw.
So it's much different because when people think about prenatal testing, they imagine amniocentesis, that
Yes.
great big needle that
Yes.
is used. What's the difference again?
Well, amniocentesis is an invasive procedure. It
Right.
carries a much higher risk of miscarriage because you're sticking a needle basically into the sac around the baby. If we get an abnormal perinatal test, we will send them for the opportunity to have an amniocentesis, but it decreases the amount of those that we're having to do.
But this is, again, just a simple blood test between mom and baby and can give you all kinds of answers.
Yes, we do them at Valley Health at any visit between 9 and 13 weeks. We give them the opportunity to have it. We can do, in addition, carrier screening. Carrier screening will test for, in our office, we do a 14 carrier screen, but it's Duchenne's muscular dystrophy, spinal muscular atrophy, alpha thalassemia, beta thalassemia, cystic fibrosis. Just gives you a lot of good information from a simple blood draw.
Now, who should consider doing this, or is it sort of standard procedure?
The American College of OBGYNs recommends that it's offered to everybody. And in a perfect world, everybody would have it. The vast majority of the time it comes back normal, and if it comes back normal, then that just gives your patient a little bit of reassurance that, okay, hey, my baby is okay, I don't have any chromosomal abnormalities, I don't have any carrier things that I have to worry about passing on.
And so this can give you a whole host of information, confidence, and if there is something, then you can make a plan.
Yes. If we find a problem, they have genetic counselors on staff. The patient can call and talk to the genetic counselor. After they do that, they can call and talk to me if there's any questions that they have. And then we also have high-risk pregnancy specialists that we will send them to for definitive diagnosis. Because this is just a screening test, even though it's 99% accurate. If we find a problem, we still have to diagnose it for sure.
Right. So are there any risks or drawbacks to doing this non-invasive testing?
The only risk is it's a blood draw, so if somebody has a needle phobia or something like that, but there's no risk to mom, no risk to the baby.
That's great news.
Yes.
Because it is much different than that, like you said, the amniocentesis would be the
Right.
next step up.
Yes.
Talk about coverage for insurance. Do most insurance companies cover this? Or is it an out-of-pocket cost for a lot of people?
It's almost universally covered. If someone doesn't have insurance, they have payment programs where they can pay anywhere from $0 to $149 out of pocket, but the vast majority of insurances are covering it if it's coded properly.
Yeah, that's good news. So it's always a conversation to have with your doctor if you're worried.
Yes.
And there's not an expectant parent out there that is not worried about their new baby's health.
Yes.
And
most of us are proactive. Most of us will bring it up. But if someone's doctor doesn't bring it up, always ask them. Because between 9 and 13 weeks, we can get a lot of valuable information from a simple blood draw.
Dr. Booth, thank you so much. There's so many things that new parents have to consider. It's such a journey of excitement. So this will take maybe some of the nerves out by providing them some answers.
All right. The only thing I'll add now that I think of it is we tend to think of people over 35 as at increased risk to have a baby with a chromosomal problem. And that's true, but the vast majority of babies are had by people under 35, and thus the universal screening.
So this is really for just about everybody.
Just about everybody.
Yeah, it can provide answers.
Even though people above 35 have a higher proportion of babies with a chromosomal problem, the vast majority are below 35 because that's where the majority of babies are being made.
That's certainly something for all expectant parents to think about and have
Yes,
that
ma'am.
conversation. Like I said, it can give you information, and knowledge is definitely power as you plan your life. it's a joyous time, and it's great to
Exactly.
be prepared.
Yes.
Dr. Booth, thank you so much. We appreciate it.
Thank you, ma'am.
Thanks for checking in for Monday Health Minutes.